Healthcare costs need to be controlled because the global economy cannot afford to render healthcare the way it is doing today. Less than 50% of the world's population has access to good quality healthcare. What we are primarily trying to do is eliminate all of the non-activities from the health system. Whatever can be done at home, whatever can be automated in the operational workflow in healthcare, can it be more predictable so that you're sure when you need to go to the hospital? We are trying to, through AI, add a lot more power to the screening tests to see how much more of the patient's disease profile can they predict, thereby bringing a lot of patients into the ambit of early detection.
I spent my first 25 years with Microsoft and I learned so much, which triggered the idea that maybe we should give back. So we're gonna have a podcast. My name is Mark Souza. I'm the Chief Technology Officer for Microsoft Asia region. We're gonna talk about technology, challenges, and solutions. So please join us. Hello, and welcome to the next episode of Let's Talk Tech. We're going to go back to the healthcare industry because it's one industry that truly sees the value and impact that generative AI has made on healthcare. And that's why today I'm super excited to invite my friend Vivek Raja Gopal, who's the Chief Analytic and AI Officer for Narayana Health.
Firstly, a couple of lines about Narayana Health itself. Narayana Health is one of the largest healthcare chains in India. We run about 47 facilities and close to 7,000 beds. And we treat close to 5 million patients a year. So that is the scale of operations that Narayana runs. I've been associated with NH for about 15 years now. I joined NH as a B school grad in 2011. Over the last 7 to 8 years, now I've been heading the analytics and AI division of Narayana Health. We have a 70-member team that takes care of every aspect of analytics and AI in NH.
So tell us a little bit about Narayana Health, the approach to the healthcare business with a focus on the transformation of healthcare.
I think all of us will agree on is that healthcare costs need to be controlled because the global economy cannot afford to render healthcare the way it is doing today. Even after doing whatever we are as a global economy, less than 50% of the world's population has access to good quality healthcare. Can we have technology take over in what is there in the current healthcare setup to ensure that 100% of the population gets access to good quality healthcare? That is the primary problem that we are looking to solve. And in solving that problem, what we are primarily trying to do is eliminate all of the non-activities from the health system. Whatever can be done at home, whatever can be automated in the operational workflow in healthcare, can all of that be automated? Can it be more predictable so that you're sure when you need to go to the hospital, all the things that need to be done for you are done in a very short amount of time and the reports come to your phone? It is the patient-doctor interaction that is the core activity of the hospital and the subsequent treatments for the patient. So we are trying to see if we can retain only that in the hospital while removing everything else through technology. We are trying to, through AI, add a lot more power to the screening tests that are inexpensive to do, can be done outside of the hospital or at home. And we're trying to add more power to these tests to see how much more of the patient's disease profile can they predict, thereby bringing a lot of patients into the ambit of early detection and bringing a lot of patients into the ambit of regular checkups, thereby reducing the load on the health systems because you will have lesser number of people who now get to a complicated stage.
Well, it's noble that Narayana Health is going after accessibility and affordability of healthcare. So thank you for what you do. I think, as you said, the people of this part of the world need this and appreciate that. With that said, tell us how, specifically with your role, how analytics and AI are helping.
One of the things that we do with analytics on the operations side, especially to improve patient experience, is firstly on reducing the wait times. For example, if the patient has to fill out a form in the hospital, or answer a few basic questions. They don't need to come to the hospital for that. We're trying to outsource that to an AI bot that the patient can take the questionnaire and do it at their convenience at their own homes and show up to the hospital only when they need to meet with the doctor. Similarly, when a patient is inside the hospital, every time they have a request or a complaint, they will have to call the nurse, and the nurse will then have to attend to it and pass it on to the necessary departments and turn it around. We're trying to see if we can automate that through simple bot that either goes on the hospital's own app or is available on WhatsApp as well. Any patient that needs anything with the hospital can simply text that number when they're inside the hospital. Hey, I need an extra pillow. When will my food come? My back is aching. Can you call the doctor? All of these will automatically be analyzed by an AI engine. Follow-up questions will be asked to the patient, and it will be categorized, and a ticket will be raised against the necessary department, and they will automatically come and close the ticket. You won't believe it. We launched it in one of our smaller hospitals to pilot it, and within a week of launching, we had 600 requests come through this channel. And that is 600 less times that the nurse has had to visit the patient. That is the kind of impact that AI can create on the operations side, AI and analytics. On the clinical side, of one of the modalities that we've been working on is the ECG. Now, coronary artery disease is one of the main killers, but coronary artery disease gets detected very late. What we're trying to do is take the ECG, which is a very simple, inexpensive test that everyone goes through multiple times in a year as part of their health checkups or their regular checkups, and trying to see if the ECG itself can predict ejection fraction. We've been able to do that. We are publishing our papers, and we are using it as a decision support assistant for some of our clinicians to begin with. Once this happens, now through just the ECG, you will be able to understand so much more of the patient's disease profile than we could do before, which means a lot of patients come into the ambit of early detection. These are all some of the impacts that analytics and AI is creating in our health system.
So are you feeding the AI models the results of the ECG and getting the information back? And how much does the clinician himself or herself utilize that data versus their own subject matter expertise?
So we're feeding in the ECG images to the AI model to generate this. This is not an automation of an existing flow of a clinician. These are adding additional capabilities to an ECG image than what is there in use today. So a clinician may not be able to determine ejection fraction or coronary artery disease from the ECG, but by training a model using ECG images and reports of these examinations, we've been able to establish a correlation between the two. So we've now started piloting it out with a few of our clinicians to validate it thoroughly clinically. And we believe in a few months' time, when this is good to go, this will make a huge impact.
Oh, this is fantastic. And I have to tell you, I just got my executive health screening last week, and I did exactly what you talked about. I walked in, I filled out forms, I sat down, I waited, I saw a doctor, I waited, I got my blood work done, I waited, et cetera, et cetera. So the fact that you're doing this, I hope all healthcare across the world learns from you. So thank you for that investment. And speaking of investment, in the healthcare industry, in every other industry, the biggest question right now is figuring out return on investment of what project you take on when. So how do you go about figuring out return on investment and what projects you take on?
So we use a 7-point framework to evaluate the potential impact of all projects that are there in the pipeline. First thing is man hours, savings in man hours. The second one is impact on direct KPIs. Any project is associated with certain objectives, which is defined by direct KPIs. Third one is indirect KPIs, where if your direct KPI is not a financial metric, your indirect KPI, you can translate it to a financial metric to get a better decision. The next one is the impact on decisions, where we have three kinds of things. One is impact on frequency of decisions. If a monthly insight is converted to a daily insight, then you get to course correct daily, therefore arrest the buildup of inefficiency. The next one is impact of earlier intervention. If you're able to compress the time to insights, say it takes 4 days for an insight to come, but if you're able to compress it to a single day, then you're eliminating 3 days of inefficiency buildup in the system, thereby improving the precision of the insight delivered by the system. And finally, impact on data quality. Analytics which is built on poor data will return poor insights, but you go ahead and publish the analytics anyway, And you will find that the system then goes on to bridge any gaps in data quality because that analytics is useful for them.
That's excellent. And we could probably do a whole session between you and I drilling into those 7 set of metrics. But the key is for our listeners is to have a consistent set of metrics to measure return on investment. So thanks for sharing that. And let's close out. As we know, generative AI in particular, the technology advancements moving 100x faster than any other technology way before it. So how do you and your team stay up with such rapid change in technology?
Especially after generative AI, things are changing by the minute. We find that every other day there is a new framework, there is a new model, a new foundational model that is open source, that is proprietary. All of that is available. And it is obviously not practical to keep changing our code base every day. What we've done is we've carved out a very small team that we call as the innovations team within our larger team. This innovations team does not have the responsibility of daily delivery of code. Their responsibility is only in doing POCs of new things that we find exciting. And once they crack a POC and find good results, they then hand it over to the main team to take it up in their regular sprints. That is something that we do at a team level.
And how big is the innovation team?
We have about 5 people.
Well, I think that is a great best practice. And thank you, Vivek, for joining us today, giving us your precious time, and for all the great work and you, Narayana Health, is doing for healthcare business. And thank you to all the listeners for joining us today. Remember, put in your comments if there is things that you want to hear, because we are listening, and we'll see you next episode.